Hello, my name is Dr. Brian Petrie from Regenerative Medicine in Raynham, and today I'd like to briefly discuss about a topic that most likely you've heard about on the internet. It's known as leaky gut disorder. However, the technical term for this is known as intestinal permeability. Now, even though heard on the internet, you may not hear this frequently through the medical profession. And why is that? It's because it's not something that's normally taught in medical school. Despite the fact that there are numerous studies published in the scientific journals regarding leaky gut disorder and its association with other health-related type issues. However, they are working on a drug to try to treat this disorder, and once this drug has been approved, I'm sure it will be plastered all over the internet. Where does the leaky gut disorders actually take place? Well, this is a diagram of the anatomy of the digestive system, and primarily where the leaky gut disorder is occurring is into the small intestine region right here. And if we blow this up and we go deeper so we get a better look at it, this is the tube, the intestines, and if we look deep inside here, we can see that it has kind of like a shag rug type appearance, which allows a lot of the absorption of our food to take place. So if we go in deeper and we look at this on a cellular level, we can see that the inner lining of the digestive tract is made up by only a single layer of cells. And each of these cells are held together by what is known as a tight junction. If you can think of the tight junctions as like a screen door in a house, they're very small holes which only allows very small things to pass through. And this area right here is where the food is traveling to be digested, okay? And it should stay within the tube itself and not pass through this area. But if you can imagine, like, your next door neighbor comes over and throws a softball through your screen door, and now you have gaping holes. That is pretty similar to what happens with the leaky gut disorder. So now what happens is gaping holes in between the cells, and that allows these undigested food particles to pass in between the cells, and it gets directly into the bloodstream. Why is that an issue? Because once these undigested food particles pass through the breach in the acellular layer, they have direct access to circulation. They'll drain right into this blood vessel here, which is known as the portal vein. Now, the importance of this portal vein is it will first drain directly into the liver. Your liver is already working enough to try to process things in the body, and it doesn't need to be burdened by any additional things that can make it work harder. But that's what happens now on a constant basis. It's trying to deal with all these undigested food particles, and it can only be a matter of time before it starts to break down because it just can't handle that load. And that can lead to what's known as chronic inflammation throughout the entire body. Once it passes through the liver, it has free reign to go anywhere, including the brain. Now, on a subsequent video, I'll talk about the mechanisms that can cause the leaky gut disorder. But it's important to know that the reason why you may have a leaky gut disorder and I have a leaky gut disorder are two totally separate things. And it's important to realize that not one treatment is going to address a leaky gut disorder for everybody. And it's really individualized based on what the mechanism that's causing your leaky gut to begin with. So please stay tuned for the next video. Thank you.